Hey folks, so I'm back with a pretty good update, a nice milestone here. I am now 1 month post-op from my ACL reconstruction, as the title of the video suggests. So I wanted to give a breakdown of how far along things have come so far and where they seem to be headed next, what's going on, and give you another look at kind of how I'm moving. We're here in my bedroom instead of in more my kind of living room area. Well, I'm pointing that way, it's over there. So hopefully, you get a sense of things, and I'll continue to be doing updates, but I'll let you know where I am at 1 month. It's exactly 1 month. I'm recording this on October 4th, and my surgery was the morning of September 4th. Overall, I think things are continuing to progress in a good direction. There are frustrations, but in general, things are going pretty well. First off, let me just show you how I'm walking. Ignore the pile of stuff on my floor right here. But as you can see, I'm not wearing any kind of brace. I'm not in any sort of support. My knee is still somewhat swollen, but it's not too bad. I can walk with a reasonably normal gait. What you will notice is, if you watch me from the side, it's probably not as easy from the front. I don't quite fully extend this knee. I have been working on that. So if I'm walking, of course, on my good leg, and I can stand on my surgical leg for a bit now, but if I take a step with my good leg, I can land with my knee completely extended, not a problem, right? When I land with my other foot, I get to about here, I can push it a little more, and I'm trying to contract my quad and extend my knee and land with as much extension as I can. It hurts, and it's not easy to do. So I am still having this tendency to land kind of with a flex knee. Of course, if I land with too flex of a knee, it's too weak and it'll collapse. So that's one of the limiting factors. But as you can tell, I can kind of switch from side to side now. This has gotten a lot better just in the last week or so. If you want a closer look, I'll prop my foot up on the chair here. You can kind of see, so there is that scar. You can see that the shape is not, it's still kind of just this bulbous, not very well defined kind of knee. There's not the taper that you would normally expect to see that you can kind of see. I have to hold on here, but you can see with my right knee, right? Much more shapely, such as it is. My knee flexion has gotten to the point, this is a little past 90 and it's not too uncomfortable. I can go deeper into flexion. I've so far gotten to about, formally we recorded it at 110. I think I'm past that now. I've been working on it some more the last couple of days. That's probably closer to 120 now. But we'll need to measure it when I go back this coming week. I'm still going to PT twice a week. Things are going fairly well. Getting a lot more aggressive massage around the scar, trying to lift that area up and keep things from sticking down too much, and also trying to get some of the swelling out. This is not soft, fluidy kind of swelling. This is much harder with some pitting edema in here. And so, of course, I have some sores back here just from like ingrown hairs from when they shave things. But you can press in and leave a nice indentation that sits there for a while. So I'm working on that. Functionally speaking, I recently, and I think I said this in my previous video, I recently started doing a little bit of cycling. The cycle at the physical therapy clinic was very nice, and it actually felt good, even though my knee kind of blew up afterwards from just all the work that we'd done, stretching work, started doing glute bridge work. I'm walking over obstacles, stepping a little higher over hurdles now, and things are, well, they're just, they are progressing. But it's one of these things where as you gain more ability, you're pushing yourself more, so it continues to hurt. It keeps sucking the whole time. But I'm thankful that I'm able to, to get this done and, to have some professional help with it. I'm trying to be aggressive. Stairs, I'm still not really stepping down with this leg. I'm starting to put a little weight on it when I'm stepping up the stairs. Going down is harder, so I really still can't step down. The eccentric control is just not there yet, but that's okay. I'll get there. And I've been in talks with my therapist about kind of how I can load it. And I have a way right now to where I take most of the weight off of my surgical leg. I let the foot stay in contact with the step, and as I step down, I kind of let my body flex my knee, kind of like a passive stretch of my quad or passively moving it. Most of the weight's actually on my arms though, as I'm stepping down. So I'm kind of doing a controlled dip almost, and my legs sort of limp underneath me, so I'm not really bearing a lot of weight on it. Just enough weight to allow the knee to bend while I kind of relax my quad on that side. So I step with my right foot, and then for my left foot, when my weight's supposed to be on that, my weight's really on my arms, if that makes sense. I'd show you if I could. At any rate, I'm going to start probably progressing. I think maybe in another week and a half, I'll start working more on stepping up and down in PT. They're going to keep me on the cycle since I can do a full revolution. I went to the gym recently and tried to cycle there, and let's just say that the equipment was not the same grade and clearly has seen better days, and so that was much harder for me to deal with. It was pretty painful. I did a few minutes and got home and was wrecked by it, so my knee is still kind of showing me who's boss sometimes. But all in all, it's getting better. The basic walking has gotten a lot better. I feel like I could go outside without my brace right now and walk around, and it wouldn't be too much of a deal, too big of an issue. It's still helpful, particularly on uneven ground or if it's at all wet, making sure to have my brace. But soon enough, I'm probably going to be freed up a little bit more on that. I'll keep you updated. Like I said, I was at the gym working on the lower body stuff a little bit with the cycling. I'm not doing any weightlifting with my lower body yet, at least with my left leg. It's going to be a while before I do any squats or leg presses or anything outside of the PT clinic probably, aside from the little home exercises I've been assigned, because I don't want to push it too much. My quad function. Here's another thing. You'll notice my right quad, not that it's fantastically developed, but I'm locking out my knee, and you can see some definition in my lateral quad here, and you can see some medial quad stuff happening. It's not great, but it's there, right? I cannot, for the life of me, get much contraction here. It's almost completely dead. Sometimes I get a little bit of movement or a little bit of a twitch or a little bit of something, but it's very little. The lion's share of the work seems to be coming from my lateral quad, which is still pretty weak. And some of that could have to do with the fact that there's still swelling in there, and swelling apparently tends to inhibit some amount of quad function. So it's like you got to work it to get rid of the swelling, but you got to get rid of the swelling to be able to work it well. So it's like a kind of a back and forth cycle you got to deal with. But hopefully that'll wake up. I might ask to do some more stimulation on it or something. I don't know. We'll see how it goes. Beyond that, I'm starting to do isometric stuff, holding my leg out, kind of practicing certain kick positions again, not standing in space. I'm always holding on to something. But that's a bit of progress there. Over the course of the next month or so, depending on how certain other function comes back, I may start trying to transition back into a lot of isometric related stuff, or a lot of positional stuff, and some very basic technique work that relates a little bit more to my martial arts stuff again. It's going to be months before I'm really able to start doing anything remotely aggressive, but as I transition back into at least certain holds, certain positions, stuff like that, foundational stuff that can help build back into the more dynamic work, I may show some of that. So if you're interested, definitely stick around for future updates on that. Things that might relate back to the previous kinds of techniques that I've shown on my channel. So if you followed previously, I will eventually try to get back to that as my knee allows me to. And maybe it'll be something that's useful for people who have had an injury of their own and maybe looking to transition back in. They can at least see my anecdotal example and get some inspiration from it or get some ideas from it. Of course, don't try to emulate what I'm doing. My body is my body. My situation is just kind of unique to me, and I'm not giving you any kind of medical advice there. Definitely talk to your care providers your physician. If you're seeing a physical therapist, follow their directives and practice good judgment there. But you can at least see what I'm going to be going through, and maybe that'll be helpful. Anyway, that's the update. We are at 1 month. I will likely do another one within the next week, maybe sooner if I have a major milestone. Speaking of milestones, I think I said before, okay, I'm at about 110 degrees of flexion formally. I'll give an update next time if that changes. My extension is not at 0 degrees. It's not straight yet, and I want to get it there, so we'll see if we make progress on that this week. But I will continue periodically updating to let you know how things are going. At any rate, thanks for watching. Make a suggestion if you see this video and you want to see something specific, if you have a question, anything like that. But yeah, that's the update for 1 month post-op with my ACL reconstruction. I'll catch you later.